hemisphere is more than just half a circle. So we all pretty much know what the brain is. The brain is the most important organ in the human body. It controls and coordinates our actions, reactions. It allows us to think and feel, and it enables us to have our memories and our feelings. All things that basically make us humans. However, just as much as the brain can be super helpful for us, it can also come with many complications, such as diseases or any damage that can happen to the brain. Due to these things, the disorder called epilepsy, which is also known as frequent seizures, can occur in a child's brain. And when seizures become too strong or too frequent to the point where medication doesn't help anymore, that's when surgical procedures like the hemispherectomy comes into play to either treat and cure the seizures itself or to make them less to the point where you don't have to take as much medications anymore. So basically, a hemispherectomy is a surgical procedure in which partial or total parts of the brain is removed due to an affected area, or it can be the disconnection of the affected area from the unaffected area. So there are two types of hemispherectomies. One is anatomic, which is in figure A, and that's when they physically remove half of your brain. And in figure B, it's functional hemispherectomy, where they remove only parts of your brain that are really affected. So the procedure usually lasts about 8 to 10 hours when everything goes as planned. First, the patient is put under a general anesthetic before going through a craniotomy, where they remove a piece of your skull with the cranial drill so the surgeons can have a place for insertion of the tools and exsertion of the brain. So the other tools that they use for the hemispherectomy is, of course, the cranial drill. They also use scalpels, tongs, hooks, forceps, brain retractors, and then suctions for the loss of blood. So basically what the surgeons do is cut the skull with the cranial drill, and once they do that, they go ahead and grab the scalpel and go straight into the brain, right in the middle, and separate the left from the right, so the affected from the unaffected, all the way down to the middle. Once they go to the center of the brain, they're going to run into the corpus callosum, and that divides the brain from left to right. And that's basically just your nerve that sends your motor, your sensory, and your cognitive signals from the right side to the left side. And it's important to cut the corpus callosum because it'll prevent from sending any damage signals from the affected side to the unaffected side. So now that everything is separated and cut from each other, that's when you have your suction to take out all the blood, and that's when they use the tongs to grab and remove the brain from inside the skull. Brain surgery recovery is long and worrisome because it can take from about weeks to months of healing. And this is due to the risks that can come from a hemispherectomy, which the main risk is the hydrocephalus, which there's an excess amount of spinal fluid in the brain, which can cause so much pressure that at the end of the whole surgery, all that it's going to do to you is more damage. The other things that can be affected due to a hemispherectomy is your speech, your memory, and your motor control. However, that's where you have your occupational, your speech, and your physical therapy that helps you get through all the risks you had and all the things you would need to relearn for any daily life activity. So before I go, I want to talk about Dr. Ben Carson, who successfully cured Jesse Hall's seizures in where they were caused by Rasmussen's encephalitis, which is a rare disease where you lose motor control, speech, and cognitive skills, followed by frequent seizures. Jesse Hall's right brain was affected and successfully removed during a 7-hour-long procedure. However, since it was the hemispherectomy, it does come with some side effects, which was the delay of her strength and movement on her left arms and legs, and also the loss of vision of her left eye. However, with the help of rehab from occupational, speech, and physical therapy, Jessie is able to thrive and get back to her normal life, seizure-free, with only half her brain. So, hemispherectomies are the main surgeries that are usually performed when medications cannot help with seizures anymore. Although this surgery isn't really certain to ending your seizures or not, but it can also be a big help. There are risks for any brain surgeries and many side effects as well. But the main goal of the hemispherectomy is a chance to get rid of any disease or seizures that can come with it. Living with half a brain is not common, but hemispherectomies show that there are many things out there to help with certain diseases or disabilities, even if it comes with risks or not.